All right, Cindy, the floor is yours.
Awesome. Hi, everyone. My name is Cindy Marks, and I am the Children and Youth with Special Health Care Needs Coordinator at Jefferson County Public Health. And I'm super nervous, but I am excited to be here today. Part of my main goal is for you to understand what a SMART team is. SMART stands for School Medical Autism Review Team, why it's important for us to have a SMART team in our community, and how you can help families who are interested access our services. So, I'm going to start with just letting you know why SMART teams were created. So through conversations with community, we realized families uh, were having barriers getting autism evaluations, and especially families who have Apple Health. So these conversations started back in 2018, 2019 is when we actually started the development of what can we create a smart team here locally. And so we've been building and building and building, and now we're finally here. So part of it is that there are limited providers that accept Apple Health for evaluations. And the SMART model was created to help families access a diagnosis faster and have it done locally. So the barriers before smart teams that families came across was um, so to receive it, if you have Apple Health, to receive a diagnosis, uh, the majority of families in our state were heading to the regional autism centers, which is Seattle Children's, or there's Mary Bridge. And as many of you know, traveling to either of those places, there's a cost. It is not just a cost with gas or ferries. There's a cost in families having to get a day off work, finding additional childcare, or anything else that might be something that they come across. And it just isn't, it wasn't a realistic option. And families knew what they needed to do, and and they knew it was just out of their reach. And the other issue that began to happen was that um, because those two centers were the centers that took Apple Health, they became incredibly backlogged. So if you were a family that was able to get there, then the wait time could be many months and oftentimes stretched into years. And everything we know about early intervention and is that the earlier the intervention, the best the outcome. So it just left families in a position where they felt stuck, knowing that you have a kiddo that needs these extra supports and not being able to access them. And and what I mean by that is to get extra supports, if like to get applied behavior analysis or developmental disability supports, you're required to have an autism diagnosis. So an autism diagnosis is more than just a piece of paper. It's like the gateway to other services. So a school medical autism review team, what we call a SMART team, it's a collaborative local approach. It brings together schools, healthcare providers, early interventions specialists, and families. And together, we're able to collaborate and get not just a small snapshot of the child, but a bigger picture of all the child's strengths and challenges. And it also gives parents the opportunity to, in the paperwork, to kind of list all the things um, the special things about their child. So SMART teams operate in partnership with the healthcare authority, and a center of excellence is what we call the provider that has completed all the state approved training through the healthcare authority. And they're the ones that are able to give the diagnosis. And it is a partnership with, like I said, the healthcare authority. So they obviously take Apple Health because they manage Apple Health. And my role in all of this is if I get a referral, and referrals can come through the schools, they can come through the primary care provider, or somebody can call and just self-refer. What I do is I talk to the family and I let them know what to expect, what the process is, and I help them coordinate how we're going to collect all this data. So I work with the schools. I, get paperwork from the primary, all medical evaluations or IEPs from the schools, and then anything from doctors. We talk to birth to 3 just to kind of get everything together. And then I gather the information and I give it to our Center of Excellence, and then they then review the paperwork and see if it's a good match for the SMART team. And then if it is a good match, then then we go ahead and schedule an evaluation. So for us here in Jefferson County, we did our soft launch in the spring of 2024. And at that time, it was the end of the school year. We had been working on this for many years. We finally had a solid team together. And we weren't sure because it was the end of the year if we could pull it off, but there was a family who really was looking for an evaluation for their kiddo who happened to be at Salish Coast. So we just kind of put it to work. We were able to gather everything we needed and do a successful evaluation for this family. And it just made the family really happy to be able to do it here. And our biggest limitation right now is we had one COE provider who was doing the work pro bono, and she committed to one evaluation a quarter. So so we have begun to grow. As we were trying to grow, we were limited. So one of the things that we decided in Jefferson County, we already have a clinic, and some of our clinics are running in our school-based health center. So we thought, why not try to have a second center of excellence here? Why not see if one of our providers is interested in taking on autism evaluations? And she did. And so it was great because she's already in Chimacum and Quilcene schools. And as you know, access in that part of the county is even more challenging. So this is the first year we have had a second COE, and so far this year we have 5 families that we're working with, and it's still only the first half of the year, so we're on track to already do many more evaluations. So we believe that having access to a diagnosis in our community here in the place you live really helps families feel more supported. It strengthens their community connection. It reduces family stress, and it just takes away unnecessary burden off the family, which none of us really, we don't want to do. And I will say from September 2024 to 25, so the last school year, we did 4 kiddos through the last year. So I know it was confusing, but we did our soft launch and we did 1 family. The following year, we did 4 families. We were limited because the COE only did 1 a quarter. And even with that limitation, she was able to do a 4th evaluation just because there was the need. The SMART team runs through the school year when kids are in school and have access to the supports that are there already. So our 2 COEs are Dr. Alexandra Murphy, and she sees children 6 and under, and Dr. Melinda Bauer, and she's a provider at Jefferson County Public Health who works at the school-based health center. And both of them have slight differences. Dr. Murphy will see kids 6 and under, and Dr. Bowers focuses on kids 3 through 12, but she's open. She's flexible if there's somebody who needs an evaluation. It's a case by case basis. And our focus is families who have Apple Health because they are the families that um, can't get an evaluation anywhere else. And Apple Health recognizes a center of excellence as a diagnosis they will then supply with additional benefits. Private insurance companies work a little bit different. And the truth is everybody knows we still have limited resources. So after the child is diagnosed, we still have limited therapies, services, and providers. But the big hope is that the more that we are, the more kids are diagnosed here in our community, and then build on adding additional providers to help support other services. So that is it. I think that is it. Does anybody have any questions?
And this is, since our presentation's done, this is a good time if you want to come off mute. You don't have to write it in the chat for that.
And I guess just to recap, because I know that I maybe went through that kind of fast. So the whole thing is that SMART teams in Washington State were created because families who have Apple Health did not have access to autism evaluations unless they traveled to regional centers. And those regional centers are out of county and often have long waiting times. So the idea of creating these SMART teams locally were just to serve more families and support kids with the additional resources. So we have kiddos who have best outcomes, best lives. That's what we all want.
So I just have a quick question, Cindy, just to make sure I'm like soaking in the info.
Yeah.
They, because you work with public health, they don't have to be like they can self-refer to you, so it's okay that they don't have like a relationship with you in the schools. They're able to like self-refer. Are you able to support them if they're out of county? So could you support someone who's in Clallam or Kitsap County?
So as long as we can collect, what we like to have is, any kind of school evaluations or assessments. That's part of what we collect. We collect information from their medical provider. As long as we can get a comprehensive look, yes, we can work with kids out of county. And the whole idea is just to be able to make it to create ease in the system and kind of like remove barriers so that um, remove barriers and create more access.
See, I saw you come off mute. Did you have a question?
Yeah, I was just gonna say like that was exactly my question that I had was like, do you have to be a Jefferson County resident in order to be able to participate in this?
And no, and I think that part of it, I don't know. I know there is a provider in Paulsbo that takes Apple Health. I don't know what their list is like, but that's the only other resource I know. Like if you are out of county and looking for another resource, that I know there is a Dr. Gomez in Paulsbo who does evaluations, but there's just not. I think that's the only one that I know.
My other question for you, Cindy, was I know with managed care organizations, do you only take particular managed care organizations or you accept all five?
Yeah, because it is because of the partnership with Smart Teams and the Healthcare Authority, there hasn't been an issue with whatever managed care plan it is.
And then Kelsey just asked if we could get a copy of this slideshow. Is that something you're able to share, Cindy? You can
Oh,
email it to me and I can
yeah.
share it out.
Yeah, I'd be happy to. I mean, I know that I went through the presentation fast, but I am super excited about more people knowing about it because what we've heard across the board is that it's something that when you need it, and it's hard to know which way to go. And so I just want as many people to know like the path that you can come to us. And even if it isn't a good match, we can help you make the next connection.
Don't remember if this was in your presentation, so forgive me if this is something you already shared, but I do know like transportation can be a barrier for some families. Is that something you all can support with, or do they need to be able to get to you all?
Yes, so they would need to get to us um, for the evaluation. Yes.
Is telehealth
But
an
that is,
option, or
but
it has to be in person?
yeah,
In person. Okay.
yeah, it is. And that would be an interesting to consider as we grow and develop, because that would be something that I think would be really helpful. If the actual evaluation, I know, there's, doesn't take a lot as far as equipment wise. So would it be eventually, um, something that could be mobile? I'm sure it could, but we're still in the growing phase.
Totally fair. Just wanted to clarify. No worries. Wendy, go ahead.
Hi, I'm Wendy Jones. I'm the school nurse corps administrator at the ESD. So I work with schools in Kitsap, Clallam, Jefferson, and North Mason counties. And I'd heard about this team coming together, and so I want to send this out to the school nurses in Jefferson. So Cindy, because I missed like the first 10 minutes, are you the main contact? Or does it say that at the beginning how
It
to
does.
actually access this?
I am the main contact. And at the beginning, for our schools, for um, Port Townsend, Quilcene, and Chimacum, and at the very beginning of the year, I sent just an introduction out to the school admin. I have been in contact with the school nurse, not the school nurse, the sped in Quilcene. Um, so yeah, I think that the more that they hear about it, just the more easier it will be to access, because I think it still is something that people are not totally familiar with.
Yeah. Right. And it's everybody knows how hard it is to get these evaluations done, and waiting lists are so long. So this is definitely a timely thing and a frustrating thing for families. And
Yeah.
especially in our smaller communities, it's not necessarily the school nurses hearing about it from someone at school. It's the early learning and early folks that aren't getting the access and getting the care needed early on. So that'd be great. I'll send it again to them, and just tell them that remind them you're the access point.
Yeah, that would be great. I mean, on our smart team, we have representatives from our local Birth to Three. So that's, I mean,
Great.
just trying to have people from all areas just to share the information is wonderful.
Thank you.
And just for context, this resource is embedded in our digital resource directory. So Kelsey and Dawn, you can access this in C2C. And then Wendy, if you're ever interested in looking at Olympic Connect's resource directory, that can be accessed at olympicconnect.org. So that will also have Cindy's information as well.
Thank you. And I've had this job for 3.5 years, and then I had it 20 years ago for 10 years. But so I have connected with OCH on and off in the last few years, but just not enough. And so it's like, oh, autism. So that kind of really caught my ear. So I'm a little late to the game, but I'm super interested in doing anything about getting the word out for folks and stuff.
Super
That's
helpful.
awesome.
Mhm.
And we're happy to have you back, Wendy. Thanks for coming back. Any other questions before we wrap up today?
Yeah, I had one. Um, about how long does it take for someone to get through the evaluation process once they connect with you?
That is a really great question. So I would say that part of it is just right now, part of it is just like as you connecting with a family, gathering the paperwork. So it can take a couple months, but that's just the kind of all the legwork. It depends on how quickly we gather everything, how quick the packet, I will be honest, the packet that a family fills out, it's substantial. We're gathering a lot of information. So sometimes in the past, there's sometimes they need a little support filling it out, and that's something that I'm happy to do. So it can take a couple months, but I always try really hard to like let the family know what's happening, where we're at, kind of keep them updated as we go through it, because I want them to know that, we're in it, we're doing it, and that not to think that we've like dropped the ball or anything.
Nice. Thanks for asking, Andy. Any other questions coming up?
Kind of probably a very obvious one, but where besides referrals, where else do you see school nurses intervening in this process, or helping or collaborating?
I don't, I don't know how close school nurses work with like, like the uh, special ed teacher or anything, but kind of, just as far as helping them make the connection and the referral, I would say that that's
Mm.
probably the most support that, or
Um,
directing a family that if the family's even just has questions and curious.
mhm. And the school nurses usually and special ed folks are usually pretty tight, because it's a lot of
Yeah,
times
I mean, so
they're high
that's
needs
great.
kids with either seizures, or a lot of high needs kids then, and stuff too. And most of the nurses do know about, hopefully the kids that do have an autism diagnosis already. Um,
And that
but
is the
yeah.
other part. Sorry for interrupting. That's the other part
Go
of
for it.
it that I think that a lot of families don't really understand, is that a school diagnosis is very different than a medical diagnosis. As far as you need a medical diagnosis to access services outside of the school. So
Yep.
oftentimes I think that families get confused because they feel like they have already had it done. And which is wonderful that they get those supports at school, but what we really want is if they need additional support through life, that they're able to access it also.
So they need the medical diagnosis before they get to you? I'm confused.
No, they don't. They don't need a medical no, we will do the medical diagnosis.
Okay, that's what I thought. I was going, uh-oh, do I have the whole
No, but I don't think that
process?
families
Okay.
understand. I think that families don't understand when they have a school diagnosis, that's not a medical diagnosis often, that they don't totally understand that. Despite if it's explained to them.
Great questions. Well, what our next steps look like is, like I mentioned, this is being recorded. We're working on sharing out all of our recorded sessions throughout the year in our December newsletter. So that is a way that you will be able to access this. You can also visit our YouTube channel, Olympic Community of Health, on YouTube, and that's where you can find all of our previous partner presentations. So it'll be labeled exactly the way that it's in your calendar. I've been trying to keep that pretty similar. It sounds like Cindy is willing to share the PowerPoint as well. So if you want to send that over, the four of you, I can email that out to you. And then for Dawn and Kelsey, since you are part of Olympic Connect, this will be added into Genius as well. So I'll make sure that the PowerPoint and the recording is added in there for future reference. So let me go ahead and stop recording.